Good morning, everyone. Congressman Lou Correa here. Wanted to welcome you to our virtual town hall to look at what's been going on in this country as well as around the world and what the challenges of COVID-19 are presenting not only to us as a country, but really specifically to uh, frontline members, our TSO officers, those federal officers that traditionally have not been considered frontline members in our battle, so to speak, not only in COVID-19, but in other areas of keeping our country secure and safe. Uh, Today, what we want to do is really talk about some of the ideas, some of the work that we have done as a committee, as Congress, and see if there's any uh, thoughts, any concerns, any gaps in terms of what we need to do to make sure that our frontline members, our thin blue line, so to speak, need from us. Uh, Traditionally in this country, we've talked about firefighters and police officers as being the front line folks that keep us safe. And now we realize that there's a whole lot more folks, especially at the federal level, our TSO officers that fit into that category. Today with us, of course, I want to welcome Dr. Everett Kelly, National President of the American Federation of Government Employees. Dr. Kelly, welcome and thank you for being with us today.
Thank you,
Of
sir.
course, my colleagues, Representative Dina Titus from Las Vegas, Representative Val Demings from Orange County, Florida, and of course yours truly. Any other Congress members on the line today? With that being said, I'm going to make some quick opening remarks in terms of what we're doing, in terms of what we're presenting legislatively. As you know, last year, TSA reduced the government's cost share of health care premiums for newly employed part-time TSO officers, essentially asking these officers to pay more for their health care. And today we understand with COVID-19 that these part-time workers are subject to the same challenges that full-time workers are. And therefore, in my opinion, and in the opinion of many in this committee, they deserve to be fully covered by health care, and their out-of-pocket cost should be zero when it comes to health care. Ms. Titus and I will be introducing this bill actually tomorrow. So look for that one. Um, uh, Mr. Payne will be also introducing some legislation co-authored by all of us that will be asking for hazardous pay for all frontline employees, especially TSA employees. And of course, our chairman, Mr. Thompson, was HR 1140, which will be asking that the same benefits go to TSO employees that are given to other federal employees. This bill, of course, what we want to do today is really included as part of our Care 2 package that we'll be voting on hopefully in the next few weeks. And of course, Ms. Deming, you also have some legislation that you will be introducing. If you could talk to us a little bit about your legislation.
Okay, great. Thank you so much, Chairman Correa, and to the Reverend Dr. Everett Kelly. Thank you so much for your long-standing leadership and for fighting for those who work with you and your organization. Of course, to my colleague in the battlefield, if you will, to Dina Titus, it's great to seeing you as well. If I could just talk for just a moment, I'm so thankful for this very critical roundtable discussion as we talk about moving forward to protecting those who are in the workplace. So if I could just begin, Mr. Chair, my remarks here.
Please, yes.
On September 11th, 2001, I was assigned as a police captain in charge of police operations at the Orlando International Airport. What started out as a pretty normal day, as I'm sure everybody under the sound of my voice remembers, it became known as the worst, most deadly day in aviation history. I remember the scrambles, the consortium calls, the meetings. I remember working with the FAA, the FBI, working with the Airport Law Enforcement Agencies Network, and the International Association of Airport and Seaport Police to ensure the safety of and try to restore the trust of the traveling public. So America called in at that time a new line of defense that we have come to know as the Transportation Security Administration. We know that the TSA was given an awesome task, a tremendous responsibility, and they have been, as we know today, all these years later, on the front line protecting us. No one planned or expected, it appears, COVID-19, but here we are, and our TSA employees are required, it's not a choice, it's mandatory, that they interact closely and daily with passengers, thereby increasing the likelihood of being exposed to COVID-19. They are there, have been there, and will be there to protect us. And now, once again, we have an opportunity to protect them. I am proud and very thankful to have the opportunity to introduce the COVID Virus Workers' Compensation for TSA Employees Act, which would provide a presumption of workplace causation for TSOs, K-9 handlers, air marshals, and other TSA employees whose duties require that they have regular contact with the public. Of course, every day we're working hard also to ensure that our TSA workers necessary to be able to effectively do their jobs, but to be able to perform their duties in a safe way. So Chairman Correa, thank you so much for your leadership. Thank you for bringing us together for this very critical call. Again, to President Kelly, thank you for what you do every day.
Thank you very much.
Mr. Chair.
Ms. Titus.
Well, thank you and good morning. Thank you for bringing us together. It's nice to see you, and Val, it's nice to hear your voice. And Dr. Kelly, it's always a pleasure. I'm here in Las Vegas and we are devastated. Our airport is down by about 90%. Nonetheless, TSA has to stay there and be sure that whoever goes through is safe. Before all this hit, I used to travel back and forth to Washington every weekend. I got to know a lot of these officers and speak to them personally every time I went through there, and they were always so professional, always putting themselves out to make sure that travelers were safe. As you recall, Mr. Chairman, we heard at a hearing on, I think it was March the 11th, from the administrator that he didn't have any intention of expanding healthcare coverage to part-time TSA officers. You and I thought that was totally unacceptable. So I am pleased to be co-sponsoring that bill with you, and thank you for your leadership on that, to give those full-time health benefits to our part-time TSO officers. Because when they're there, they're doing the exact same thing as anybody else. There are also from other bills that you referenced, and Ms. Demings as well, that I am pleased to co-sponsor and support. So it's great to be with you this morning and talk about to people who are often just taken for granted and sometimes even treated poorly because people are in a hurry or they think they shouldn't have their luggage looked at or they get indignant. So it's not the best of circumstances on any day. So thank you for having us, and please count on us.
Thank you very much, Ms. Titus. Dr. Kelly, as you know, COVID-19 has really presented to us facts, evidence beyond a reasonable doubt that, hello? Dr. Kelly, can you hear me?
Yes, I can hear you.
Thank you, sir. As I was saying, COVID-19 has really presented evidence beyond a reasonable doubt that our TSA employees are frontline warriors. They protect us, they protect our families, and now we are realizing that they need to be treated, respected, and afforded the same benefits and protections as other frontline members in our society. Dr. Kelly, what are the areas that we need to focus on right now? What are you hearing right now from your folks out there? Where do we need to go? What else do we need to do?
Well, first of all, thank you, Chairman Correa, and to all the committee members present today. And thank you for inviting me to join you in this most important conversation. I just want you to know that AFGE is greatly appreciative of your leadership and that of Chairman Thompson to approve Title V collective bargaining rights in HR 1140 in committee, and for the first time move the bill to bipartisan passage in the full House just last month. At a time when we spend every waking moment protecting the rights and lives of federal workers, we're particularly grateful for our partnership in Congress working to ensure they have safe and healthy working conditions. I thank you, Chairman Correa and Congresswoman Titus and Dimmons for stepping up with legislation to ensure this workforce is not left behind and get the protection they need on the front line protecting the flying public. TSOs have the same needs as the rest of the federal workforce. However, because they are not under Title V of the U.S. Code, it's necessary to add extra language in order to cover them in legislation. As frontline employees, a full 500 of whom have contracted COVID-19 while working at their airports, TSOs need hazardous duty pay, the presumption of workplace illnesses with the rights to workers' compensation. They need protection of an OSHA temporary standard for a pandemic. Specific to TSA, the agency was granted the flexibility to hire a large portion of its workforce, over 20%, as part-time to meet the needs of heavy and light travel times. With this, they agreed to cover the full federal share of the health insurance premium for the low-paid workforce. For no reason, TSA took that away last year. Even full-time TSOs have such low pay, it is difficult to afford health insurance, and part-timers are really unable to afford the premium. We thank Chairman Correa, Congresswoman Titus, for the legislation to restore the part-time premium and allow a period of time for employees to enroll or exchange their health insurance, so these essential frontline employees are not sidelined without health insurance for themselves and for their families. Also, specific to TSOs, when TSAs was created, its administrator was given unusual broad power to develop and administer a separate and unequal personal management system. As I noted, we're grateful to this committee for passing legislation to finally provide collective bargaining rights to TSOs. We have worked on legislation to address the needs of the federal workforce. Those who are not covered under Title V can sometimes be an afterthought. We need to make sure these employees are under Title V and have due process protection before we experience the next wave of COVID-19. We cannot further endanger this workforce. This legislation must be a part of emergency appropriations to address coronavirus. We've also heard concern from our TSOs that many passengers are coming through the security line without wearing a mask, threatening the health of TSOs. This will become an even greater problem when higher travel volume resume. TSA should require that all passengers wearing a mask wear a mask in order to enter the security process. I also noted we've already lost TSOs to COVID-19. We hope this committee will continue and consider legislation to provide their survivors with benefits, benefiting their services fallen public safety officers that families have received. Finally, you're also aware that the last FAA reauthorization included the TSA Modernization Act, with the requirement in Section 1907 to create a working group of management and labor representatives to recommend changes to TSO's personnel management system, including appeals to the merit system, protection board, and grievance procedure rights. TSOs, they could have those under Title V. The agreed upon recommendation did not achieve their statutory goals and were quite meager. They have yet to be implemented, even though the administration approved them in December of 2019. So I just wanted to say that, and as always, it's good to see all of you, and Congresswoman Dimmons, it's always good to see you again, and always a pleasure to work with you.
And let me add that that was such a mistake, a travesty to take away healthcare benefits for part-time workers. And I know the budgetary challenges are always the explanation, but we've got to focus back on that security fee that we charge every passenger that flies. That fee is supposed to go towards security of those that fly. It's supposed to go towards these kinds of expenses. And we all know it's used really to balance our federal budget, something that is just doesn't make sense. We'll continue to work on that issue too. But, Dr. Kelly, you bring up a very important issue, which is survivor benefits. And I know Ms. Deming has legislation, again, to address the issue of presumptive issues. And I think that is also presumption. If you die on the line and it's due to something like COVID-19, then the presumption should apply in such situations.
I'm sorry, I didn't hear you, sir. I didn't understand you.
Can you hear me?
I can hear you now.
You can hear me now.
I can
Okay.
hear you.
I'll repeat myself. The issue of presumptiveness, healthcare benefits, death benefits, COVID-19. My point was that you die in the line of duty, then your family, your survivors should have some benefits, and the presumption should be that those kinds of illnesses, those kinds of tragedies were because of your job, because of performing your duties, and therefore survivors should have some benefits. Those should be presumptions. That should be part of the job, part of the benefit package.
Absolutely, sir. And thank you for that. It just makes sense. I mean, virtually in every other occupation, that is a presumption that's understood. And so it should be also with the TSOs, they're out performing a duty and a service to the American public. And it's only reasonable to expect that form of presumption. I mean, if there is a widower, I mean, that widower should be able to anticipate that there's going to be something, in line for them in the event that one spouse or loved one passes away in the event of this type of virus.
Thank you very much, Dr. Kelly. I think you're absolutely right. This is in line with our Chairman Thompson's mission, which is to really professionalize the workforce, make sure we have the best of the best, that they're trained to do what they're supposed to do, which is keep ourselves and our families safe while they travel.
Mr. Chairman?
Yes, Ms. Titus.
Thank you. Dr. Kelly mentioned about passengers should wear a mask when they go through the airport. I completely agree with that. But I'd like to ask and be sure that the TSA is getting all the PPE that they need, because they need protective gear and equipment being on the front lines too. And we've heard such horror stories about how we lack that. There aren't enough gowns. Doctors don't have it at TSA. Could you address that, Dr. Kelly?
Well, let me just say that, first of all, TSO was at first slow in responding, and the response was inconsistent, if you will. The federal security directors at many airports did not allow masks and, these things to be given to the TSOs. They didn't provide them, and many times didn't even allow them to supply their own. In some cases, they were told that if they needed to wear a mask because of an underlying health condition, they would need to disclose that. The plan to require gloves at all points in the security process was not communicated until the first 3 TSOs contracted the COVID-19 at the San Jose airport. They have since conducted calls with their union, with our union leaders, but not always been responsive to their requests. For instance, the union is still seeking clarity on leave documentation when the TSO has conditions that may put them at greater risk at the workplace and on shift during the downsized time. They report the dates and location of positive coronavirus tests on the part of TSOs, which is why the number is at 500. And we know that at least 5 TSOs have died from the infection. I would also note that TSA initially told our workforce that they would consider anyone who was working in public places as presumed to have hadn't contracted the virus at the workplace. But then they quickly backtracked and said it's up to the Department of Labor. So the one time where running their own personnel management system would benefit the 500 would have contracted the virus. TSA management declined to do so. So they've done some things well, if I may add as well. But those are some areas where I think that they was a little slow and inconsistent.
Thank you. Maybe we can work on those as well, Mr. Chairman.
Yes, and Dr. Kelly, can you tell me briefly how have the families of those 5 heroes that have sacrificed their life for our safety, how have those families been treated? Are they getting the benefits that they're entitled to?
You know, I can say this, that we have been very fortunate at FGE to have, established a program to assist the families, in filing claims and those types of things. We have a complete department that's working around the clock to make sure that that happens. And so I think that because we have that program set up to assist the members, they have been able to get their claims filed and those type of things. But we still have, some work to do.
Would you keep us appraised, sir? I'd like to make sure that we have some justice in this situation.
Certainly will, sir.
Thank you very much.
My pleasure as well, to contact some of those families and, just to pray with them and let them know that not only is AFG concerned about them, but we have a whole team in the Congress that's equally concerned.
Ms. Titus, go ahead.
Just going back to the points that Dr. Kelly made in answering my question about PP&E, I know we sent a letter in support of them getting the equipment they need. That's why I was wondering if that had any effect or not. So something I think needs further pursuit.
Thank you for that letter.
Dr. Kelly,
Mr. Chairman? Mr. Chairman, if I may?
Ms. Demings, of course, please.
Thank you. Dr. Kelly, I think back to when we unfortunately had the government shut down, and it was just reassuring watching the TSOs come together and just kind of meet the needs that each other had. So I am not surprised to hear you talk about how they have come together to comfort and provide support for those families. And just keeping an eye on our airport here, I know that we talked about masks and gloves, and our airport here also installed some plexiglass barriers to be between the traveling public and the TSOs. They're also practicing social distancing where they can. In addition to those things, are there other procedures or practices or policies that are going on that you are aware of that we could probably share around the nation on a national basis? And based on what you've seen and where we are right now, what are still some of the needs out there to address some of the challenges in the workplace for your employees?
Well, I have to go back to say and that I think that we're going to have to begin to request that the flying public wear masks because, it's my understanding that this virus is an airborne virus, right? And so I think that's going to have to become a priority, is that not just the TSOs are protecting themselves, but that the flying public also help protect themselves as well as the TSOs. Because if the TSOs get the virus and become sick, then who's going to make sure that the public can fly? So I think that would be one thing that I would make as a priority. Thank you, Congresswoman.
Thank you.
Thank you very much, Ms. Demings. Mr. Kelly, Dr. Kelly, I'd like to establish some kind of a working group, a working relationship with you so that we can touch on these issues on a weekly, periodic basis to make sure that there is some meaningful progress being made. Basic things like protective gear, like Ms. Titus was saying, we did write a letter, we signed the letter. we want to make sure that the response to those letters, the response to those timely requests is immediate. We don't want to be waiting until weeks go by when we know this is the danger that is ongoing every day, every moment that passengers actually fly. So I would like to touch bases with you next week again and see if there's been any progress, if there's any holes that haven't been addressed in the safety of our TSO officers.
Thank you, sir, and I welcome that opportunity. Thank you so very much.
Thank you, sir. Any further comments or questions or thoughts from my colleagues?
Mr. Chair, I just want to say I think this is a great opportunity as well to work with our airport councils to look into making sure that the traveling public takes individual responsibility. That's something that we talked about on the whip call on yesterday, that each individual has to take responsibility if we're going to get this virus where we need to and see those numbers go to zero. So I look forward to working with you, and I'm just so thankful for Chairman Thompson's leadership and other members of our committee to work with councils and others to get this job done. Thank you.
Ms. Demings, you bring a very, very good point, which is individual responsibility. Here at home, I've noticed that some supermarkets, if you do not have a mask on, they will not let you in to go shopping. And so you do see a change in attitude, a change in behavior, but it's a change that has to be drilled down into each individual, that you got to change the way we do business, at least in the short term.
Thank you.
Ms. Titus?
Thank you, Mr. Chairman. I would just say that as we talk about opening up the country, that's going to be coming soon. We're already seeing it state by state. It varies. I think it's really important that you are having these meetings so we can get ahead of it, because more and more people are going to be flying in the near future. We don't want to wait until these numbers increase and then go, oh, what should we have done, or what can we do now after the fact? So it's great that we're doing this now.
Hello? Hello?
I can hear you.
Hello?
I can hear you, Mr. Chair.
I can as well, sir.
I think Representative Titus may have dropped off. There may have been some connection issues.
Right.
Okay, so it looks like we've had some connection issues. Let me just say, Dr. Kelly, can you still hear me?
I can hear you. I can hear you.
Okay, great. Again, let me just say to you, congratulations on your ascension to the presidency. I know that you understand the awesome responsibility and take the job very, very seriously, and just continue to do a good job in terms of looking out for the tens of thousands of persons that you represent. And understand too that under the leadership of Chairman Thompson, we take our positions very, very seriously. We're going to continue to work with our colleagues on the other side of the aisle to make sure that employees on the front line, and Chairman was absolutely correct, we've had to define in our minds the way we think about what frontline employees, who those frontline employees are. Having been there from the very beginning when the TSOs came on board, I understand the critical role that they play every day to keep us safe, the traveling public all over this nation, and quite frankly, all over the world. Know that we will continue to work along with you and the men and women that you represent to make sure that you have the support, the benefits, and the equipment to continue to do an effective and efficient job and do it very, very safely. So as we wrap up this session, President Kelly, I'd just like to call on you to share any closing thoughts that you may have.
Well, first of all, I just want to say thank you for including me in this important discussion. I'm working to make sure that the federal workforce has protection and rights to battle this coronavirus pandemic. It's heartening to know this committee is working with us toward the same goal. I greatly appreciate your special focus on transportation security officers. They are out there protecting the flying public, even though they receive some of the lowest pay and have the fewest workplace protection, just as they did during last year's government shutdown. They come to work and they fulfill the agency's mission. And I look forward to continuing to work with the committee as you address the needs of the TSOs and the entire Department of Homeland Security. I'm especially appreciative of Chairman Thompson, who continue to do an outstanding job at putting these things on the forefront. So with that being said, again, I look forward to continued working relationship with you and this committee, and many blessings to all of you.
Thank you so much. And that concludes this critical, very important roundtable discussion. More to follow.